Patient.
Provider. Hi, Miss Williams.
Hi, how are you?
My name's Julie.
Nice to meet you.
So what brings you in today?
My little daughter, Amy, is here for a 6-month checkup, and she's had several inner ear infections. I think that's what she has again.
Okay. So my preceptor said that he had just came in and said that she had a bunch of ear infections. Do you smoke by any chance?
Yeah, I do.
How long have you smoked?
I smoked for since I was 12,
Since you were 12.
I've been a pack-a-day smoker ever since.
And how old are you now?
I am 33.
You're 33. Okay. So how long has your daughter been getting these ear infections for?
She's had several over the last few months.
Okay. And they've just kind of been getting recurrent?
Mm-hmm. Yeah, that's what it seems like.
Actually, a cause of ear infections can also be exposure to secondhand smoke.
Oh, really?
And I don't want to put this blame on you. It's something that a lot of people don't know. Actually, people think secondhand smoke mostly lung issues.
Yeah.
But it's also related to smoking. Interesting enough. Don't be scared about this at all. There's many approaches that we can get to fix this. I don't know if you were interested in quitting or cutting back at all, or what's your trigger to smoking?
Let's see. My husband left, so I'm a single mother, and I just feel like the smoking really calms my nerves with having to take care of my daughter, and then my mom's living in home too, and so I just have to take care of both of them, and then I have to work. There's a lot going on, so I think just smoking really
relieves that.
Mm-hmm.
Do you think that you'd be interested in quitting or cutting back, or?
Maybe, but if it'll help my baby, yeah, I will.
Okay. So, what I usually do is I sit down with my patients and we discuss ways that we can just start quitting. There's different medicines that you can take to get on, or there's certain you can maybe start to begin by cutting back and not smoking in front of your daughter.
Okay.
First of all, I don't know, do you smoke in front of your daughter?
I try not to, just because I don't want her to also be a smoker. But my mother's boyfriend is a smoker as well, and he stays at the home for really long periods of time.
Okay.
So
In terms of, we'll take two approaches to this. In terms of you maybe quitting, because you said you were interested in doing such, and then your mother's boyfriend smoking around your child.
Yeah.
So first, in terms of your mother's boyfriend, I think it would be good for you to just kind of sit down with him and say, I went to the doctors and I learned that secondhand smoke can often lead to ear infections. And so if you wouldn't mind maybe smoking outside of the house, changing your clothes, washing your hands before you play with Amy.
Okay.
In terms of you quitting, I really find it helpful for a lot of my patients to set a quit date in mind.
Okay.
So
how far out do you think that should make it?
I would say I would start cutting back originally now, unless you're willing to go cold turkey. Some of my patients have a lot of good success going.
I think the cigarettes really help me coping with stress.
Okay, and then maybe so we could set a quit date in mind, maybe 2 weeks from now. I don't know. Is that too soon for you?
A quit date? Yeah, that's really close. I have to still have to talk with them at home and everything.
Okay, so maybe we could set a quit date from a month from now. I don't know. Would that be good?
Maybe. Can it more just be a cut back date?
Oh, we could do that. We could set timelines for cutting back, and then We could like set like a final day, and
Yeah.
I don't know if you'd like be wanting to get on like Chantix, or like I have like a lot of like
I don't know if I really want to go on any vacations right yet.
okay, and there's also like nicotine gum in like patches and lozenges. I don't know if you'd be interested in that too.
Maybe we'll see how these next few months go with the slowing down.
Okay.
Is there any like, do you know anything I could do to try and cut back and like resist the urge or something?
Yeah, so some of my patients have like kept diaries too about certain like triggers that make them smoke.
Okay.
And then they find other ways to like sort of like, oh, like instead of walking on this path, this is what I always do. Like I'll walk on this path and then smoke a cigarette just because it's like always been on my mind, and that's something that I'm always like, it's just like kind of habit kind of a thing. So like finding other ways to like fill that habit has been a really good thing. So identifying their triggers. And then maybe instead of like, if you take that path every day, maybe take a new path.
Okay.
So that like, you're not like you're not going to like put a cigarette in your mouth just out of habit.
Yeah. Okay. I didn't think about that before. Yeah, I'll definitely try that out. What about how should I go about talking with my my family at home and smoking in the house?
I can give you pamphlets too, so it's not just like coming out of the blue, that the risks of secondhand smoke and even the risks of smoking in general. And you can just sit down with them, and you can even have them come in at your next visit if you want to, and I'm more than happy to discuss it with them. And if they're interested in quitting at all, we can like start setting like cutback dates that you had like, and just maybe just say it's my daughter's health. I really would like for you to maybe smoke outside of the house or away from the house, and just like change your clothes when you like play with Amy.
Okay. What are the risks so I can tell them, so hopefully we can all stop together?
Yeah, so it can lead to lung cancer. It can cause various like cardiovascular health problems in children. It's often linked to like ear infections and things like that. Like a lot of people don't realize that it's also the secondhand smoke too that can cause it, or even like thirdhand smoke when it's on your clothes, and it can cause other health problems in terms of people around you. Yeah.
Okay. Do you think there's like something we could all do together that would like help us to stop, like as a group?
Yeah, maybe if you guys have the same timeline. I don't know where they are in terms of them wanting to quit, but so who's smoking in your family? Is your mother smoking?
Yeah, my mom smokes. She takes 2 packs a day. It's been like, I don't know, 30-some years.
Wow.
Yeah.
And her boyfriend smokes and you smoke? Everyone smokes in the family?
Yeah.
Okay, so maybe we can just set like dates. Maybe next we can have you come in and we can set like just so we have everybody together. And in terms of like trying to figure out what everybody's comfortable with doing, if other people want to get on certain medications to help them and assist them in smoking. A lot of my patients have had success with that, but also a lot of my patients have had success with just like monitoring quit dates and setting goals for yourself and like keeping a journal to stay on track. And there's like certain, I can give you certain resources that have helped my patients in terms of like identifying their triggers and what to do.
Is there anything that would make my like daughter susceptible to like more ear infections? Because I did smoke throughout pregnancy as well. So,
you did?
Yeah. So do you think that like is causing her to be more susceptible than other babies who have smoker parents?
I personally don't know the answer to that question.
Okay.
But I could talk to my preceptor and I could find the answer out for you.
Okay.
But in terms of that, I mean, I would say as of right now, it's most important for us to like get on track with maybe quitting smoking for now, or smoking away from your child for now, just so like she stops getting these chronic ear infections. Okay. But we can explore that path too.
Okay. And the drugs that you give her for her ear infections, they're not going to like stop working randomly, right? For her ear infections? No. Okay.
No. So your child's still going to be on those medicines. This is just going to prevent them in the future from recurring.
Okay. All right. Then is there any chance like she has more of a chance to become a smoker since we all smoke?
Yeah, she does have a higher incidence just because it's kind of behavioral. Like, your daughter is 6 months old right now, so she doesn't really see you smoking. It doesn't register for her. She's just getting these chronic ear infections and crying, and so she doesn't really realize that. So, I mean, I think that's a huge benefit, too. Your child might not end up smoking because she doesn't see it happening in the house. Like children who are like more susceptible to it because they see it occurring. Like,
Okay.
oh, my mom, my dad, my grandmother, they smoke, so it's just kind of like out of habit. Like, oh, like I should smoke too. So I actually think that's super important.
Okay.
So I'd like to see you back in, like, sit down with your family.
Yeah.
I'd like to see you back in maybe 3 weeks.
Okay.
And I would say start cutting back. How much did you say you smoke?
A pack a day.
A pack a day.
Yeah.
So maybe we can try to like cut it down by like maybe three-fourths a day. I don't know if you can cut off a certain amount for now. And then every day, maybe like smoke one less cigarette.
Okay.
And then we can go from there. And then I'll see you all back. I'd like to see you all back in the office in 3 or 4 weeks. And maybe we can set like a definitive plan.
Okay, great.
Cool. Thank you. Have a good one.
You too.